I haven't came across realistic medicine myself, but from my understanding, because I've only recently just heard briefly about it, is that it's all about kind of tailoring treatments to suit the patient's lifestyle. So I guess if the patient isn't willing to take something, or if the patient doesn't think this is really going to help me, or if it's going to drastically change their lifestyle, it's about working with the patient to make the changes that actually will make a difference for them.
Actually not, I haven't heard realistic medicine. I have heard the term realistic but not realistic medicine.
It's about being person-centred. Everyone has different circumstances, different lifestyles, different preferences, and in order for good outcomes you have to be realistic and collaborative and work with me and not just tell me what suits me best.
I think the days of people being passive recipients of services are over. I think especially with the internet and with Google, everybody is now a lot more aware about how to access information about their health condition, so they've got a lot more questions, and it's about a partnership between the person experiencing the condition and the healthcare providers, where each brings something to that party.
My son had something here, a note, I think they call, I'm not sure, but I was scared that it might be cancer. I checked online and the answer were more direct into cancer. And since I've seen that on Saturday, I just thought, oh, you know what, I should not wait until Monday, because if I go to my GP, nothing will be done. Let me go to the hospital and they won't let you go until they've done something about it. Why I didn't go is because I know that anytime you go there, you are fine, you'll be fine, just wait for a few days, it will get better. Listening and respect a little bit, because when somebody is not giving you what you want, you feel like they don't really care about you.
I think one of the challenges that doctors have sometimes is they're under a time pressure. So people sometimes don't go along to the doctor that well prepared, because depending on what generation they are, and depending on what generation the doctor is, there is still this perception of the doctor as a godlike being, that you passively sit and wait to see what they're going to tell you is wrong. So there needs to be new communications and new connections built, so that we as individuals use that limited time with health professionals to best advantage, and also the health professionals use that limited time to best advantage by being more connected, more aware of, well, what else is there apart from simply handing over a prescription.
The main priority is that a relationship can build so that there's trust on both sides, and mutual trust is difficult when you have 10 minutes and you maybe don't know someone, or you're getting passed from pillar to post, or it's a doctor in hospital you've never come across before who doesn't know your case.
Professionals need to take an approach where they go out and seek information rather than waiting on the information coming to them. They need to respond to people before things become a crisis by visiting them in places that they're most comfortable, be it their home or at extracurricular activities, somewhere that the person feels safe and able to talk, and that isn't always best placed in a GP's office.
All about communication is about the doctor listening to you, actually listening to like what you're doing in your life and what way you're living your life and what is going on with your body. I think doctors these days are quick to jump to conclusions that aren't actually what is actually happening, even though there's like rare conditions and things, and there may be like something that they think, oh, it's definitely not that. I think it's important to actually listen to the patient.
People do want to be more involved in the decisions that's important for their life, and I think if we promote far more about what shared decision making really means, and also that health professionals are trained and supported to understand what shared decision making is, then I think it'll be a lot easier to move forward. There's an awful lot of work needs to be done to create psychologically safe places where health professionals can be the best that they want to be, because the reason why they became health professionals was because they cared.
A friend of mine was once, it took a long time for her to be diagnosed with the conditions I have, which is lupus and Sjogren's, which are quite rare autoimmune diseases. And when she finally was diagnosed, she sort of got quite tearful and looked at her consultant and said, why do you think I have this when no one else has? And I've been going through this for years with other doctors. And her consultant looked at her and said, because I choose to believe my patients. And that seems to me to be what makes a good doctor.